specialist in India. Today it's a very important announcement we want to make. We want to create an awareness around the tailbone health. So we want to launch first time in India Coccyx Awareness Day, which will be celebrated or observed on 1st of October every year. This initiative is to bring in awareness and knowledge and the condition called as Coccydynia, which people are suffering silently without having a knowledge about how this condition can happen and what is the treatment. There is a treatment which is available, so correct diagnosis is needed. For all these kind of awareness, we have come with this initiative to create the whole campaign. First thing is, what is Coccydynia? Coccydynia is a condition where people start feeling the pain on the tip of the spine, that is the end part of the spine between the buttocks. So this pain can radiate to your upper body and also to your lower body. Specifically felt only when you are sitting for prolonged period of time, sit to stand transitions, and when you are sleeping also. So this is called as Coccydynia. This awareness campaign is all about Coccyx, injury and Coccydynia. So what are the symptoms that you will get to know, that how you will understand you have Coccyx pain or Coccydynia, or you have injured your Coccyx? That is, a person, if you feel that you prefer to stand instead of sitting on a very luxurious sofa, if you prefer to walk instead of traveling in a high-end car, then you think that there is something wrong in the Coccyx. So ideally a person will avoid as much as sitting as possible. So that's where you have to understand, okay, something is not ideally right. I need to evaluate whether I have it or not. This is one basic example. Now coming to a normal symptoms, person cannot sit for a long period of time. They feel like they are sitting on a very sharp knife, and sit to stand they will feel some kind of a shocking sensation which is felt in between the buttocks and also towards the glute area, and pain while passing the motion. Defecation is very painful, and also pain during the intercourse. So these are the very important symptoms which people can identify if they have Coccyx pain. Now what are the main reasons you get into Coccydynia? Coccydynia, the major 60 to 70% on research basis, you can see that it is very common with the people who are going for a prolonged sitting, desk job, IT professional, bankers, because they sit for a prolonged period of time. There's a lot of pressure which is exerted on the bone. Now to understand why, because tailbone has a lot of muscles which is attached around it, not over it. Over the bone it is very a simple fascia and the skin. So the tailbone is too much superficial and it is vulnerable for the force or the pressure which is being exerted on the bone. So it is very common if a person is sitting on a hard surface or a poorly designed chair, they are prone to get this kind of a condition called as Coccydynia. Now that is one part. Second is pregnancy. It is very common in women compared to men because of the anatomically designed pelvis which is there, and also due to the force which the lady goes through the pregnancy journey. So the head of the child passes over the bone during the normal delivery. So there is high chance that the bone can be strained or can be fractured or dislocated. So this is the second important part where you get into Coccyx pain. Third thing is trauma. It's very common to have a trauma, like person can have a fall in the bathroom, slip from the steps, or when you're having a bike accidents, or doing like you are birthday bumps. All these things can cause a lot of trauma to the tailbone and you can lead into tailbone pain. Now last not the least is, there are certain pains where you are idiopathically, we are not able to understand what is exact cause. It could be posture, it could be because of long prolonged two-wheelers, or like long journeys in the four-wheelers can also lead where exact reason is not being found. That's called as idiopathic. So this is about what is the symptoms and what are the causes. Now coming to how you can come up with a diagnosis. Like there are, as in the upcoming video, you can see a renowned radiologist by name Dr. Deepak will elaborate on the part of imaging. I would like to tell you that if you have Coccydynia, the important tool of diagnosis is dynamic tailbone X-ray. This X-ray is taken in different waves, sit, stand, sleep. We try to study the dynamic mobility of coccyx in different positions. So specifically the most important position is the sitting position. That you can understand in our videos in our channel, and also Dr. Deepak will put some light on it. Okay, MRIs and CTs are also a very good, ideally we use it in the investigation procedure. Now the main part is what we do it is in, see, tailbone pain is not only the pain which is situated at the tip. Once you get into coccyx pain, the person starts adapting to a position to, leaning to the side or leaning forward to adjust their pain. So this causes the postural misalignment on the whole spine. So which will cause associated area involvement also. So when you do these kind of measures to to ease up your pain, you are actually landing with much more problematic situation. So treatment what we do in our clinic, or what exactly you should be doing if you get into coccyx is, first part is get an X-ray. You will come to a conclusion what type of injury you have, what is the treatment line. Now in treatment line, I myself specialist in coccyx, what I do is I do coccyx internal manipulation. It's a very skillful technique which has to be done in a very precautionary way. Second thing is a rehabilitation protocol which we follow for the particular muscles which are affected, and also the postural correctioning of every person who is going through the coccyx pain. So the main agenda of the treatment is to correct the bone which has gone into misalignment, whether it is angulation, whether it is subluxation. The bone which has been, normally the alignment of the bone is shifted to some other, like either it has gone backward or it has gone front or it has gone laterally. These are the major, dislocation or the subluxation where it will happen in the tailbone. So the whole treatment falls into this, how you are going to relocate the bone to the normal alignment. This is the process what we are doing in our place, that's JP Nagar Clinic. So this camp or the campaign awareness day is all about getting the people to understand that there is a condition, it is real, and there is a diagnosis to understand that there is a problem called as Coccydynia, and there is a treatment line also which people have to understand it exists. And last not the least, I would like my colleague Dr. Deepak, who is a renowned radiologist working in Bangalore with 2 decades of experience, will put some light on the imaging factor. And also Dr. Pavana, she's a clinical psychologist working with a huge number of experience with all the different patients. So now why we have choose them? Because they are going to talk about the imaging, and Pavana is going to explain about how this mind and body connection matters. So thank you so much. Please keep watching this video and spread this video as many number of times to many people as much as you can. It's not about sharing, it's about that if one of you will share this video and it reaches to the person who is suffering, we are going to reach the utmost goal what we want. So the point is, you need to understand that there is a pain, people have to acknowledge it. For that, this awareness has been created. Thank you so much. Hope this video will be helpful for each one of you. and we need lot of your support and blessing so that we can reach much more in a better way for helping the people in and around. Thank you so much. Happy CT.
Hello, I'm Dr. Deepak Y.S, Lead Consultant Radiologist at Diagnostics, Nagarbavi, Bangalore. Today I'll be just giving you a short talk on the importance of radiology in helping in treating and diagnosing coccydynia. So there are mainly the most important source of imaging for coccydynia is dynamic X-ray. So 70% of the causes of coccydynia can be diagnosed with dynamic X-rays. In dynamic X-rays, we take multiple views in two positions. That is, one is in the standing position and one is in the sitting position. So in sitting position, the coccyx is under dynamic force and we see whether there is any hypermobility or subluxation of the coccyx with respect to the standing position X-rays. So X-rays plays a very important initial role in diagnosing of coccydynia. The other imaging techniques we use frequently are CT and MRI. In CT scan, we get to know any fractures of the coccyx and even subluxation is also well made out on CTs. MRIs plays a more important role when we are suspecting any mass lesions arising out of the coccyx, any soft tissue involvement of the soft tissues around the coccyx. So all in all, radiology plays a very important role not just in identifying and diagnosing coccydynia but also helps in guiding in the right treatment of coccydynia. I've been associated with Dr. Mubashira, who is a leading person in the field of treatment of coccydynia for nearly a decade, and her expertise is certainly very helpful in guiding in the right treatment and management of coccydynia.
Hello, I'm Dr. Pavana Rao. Today, we are going to talk about the connection between physical health and psychological health in the context of coccydynia. The mind and the body are very deeply connected and influence each other in ways that are more powerful than we realize. In tailbone pain may seem like a small issue from the outside, but for a person who is experiencing it, it can be very, very difficult and overwhelming. It can limit simple activities like sitting, driving, sleeping, and going outside or working. Over time, chronic tailbone pain can affect the psychological well-being of a person. It can lead a person to feel depressed, anxious, frustrated, and isolated. Combined with tasks that they once did without thinking may seem impossible or difficult with this pain. This may lead to a lot of isolation and feelings of being very, very overwhelmed. At the same time, we also know that emotional health can affect physical pain. Pain and emotion are processed in similar parts of the brain. That is why if a person is depressed or anxious, his nervous system can become very sensitive, increasing the intensity of their pain experience. Chemicals like serotonin and norepinephrine, which regulate both mood and emotion, are seen to be lower in people who are depressed, which is why depressed people can feel pain more intensely than others. Which is why mental health support in the context of coccydynia may be very, very important. Even if your main concern is physical pain, take help for psychological difficulties as well. Psychotherapy can help with building coping skills, resilience, and in better management of stress, which can in turn help manage the pain better. So, if you are struggling with tailbone pain, take help early and then you will feel that you will get better very quickly. Thank you.
Hi, my name is Swarna and I can proudly say that I was a coccyx patient. I was diagnosed with this in 2021 and now I am pain-free. It all started by me just cleaning a balcony and falling, and I thought it was just a normal fall and we were laughing about it, and then after a few weeks I had some pain and it was started to become really uncomfortable. I work from my home, so mostly it's on laptop. So I usually sit, sedentary lifestyle. I just sit and work. And there was pain when I was trying to stand up from the chair or sit down, or I was not able to really sleep well. It was a very unexplainable pain because you feel it inside your body versus outside. You do feel that there is something happening inside. So I did not know what was happening, so I went to a doctor, and it was a general physician. They looked at me, they asked me to do some stretches, and everything seemed okay. They gave me painkillers, but it didn't work. After 2 weeks, I happened to be in my parents' place, and there again this came back. I was immediately rushed to an ortho surgeon hospital, and they also checked me. They took an x-ray while I was standing up, and they did mention that there is something wrong with my tailbone and there is some inflammation around the area. So they gave me painkillers again and asked me to do certain exercises. 2 weeks from that, pain still did not go away. I again went to a spinal specialist in Bangalore, where they asked me if I could do a steroid injection, and I was not really convinced because I really did not understand what was going wrong. So it was almost 2 months since I was in pain, and I was really stuck because I couldn't travel, I couldn't work, I was in a lot of pain. So then I happened to find out Syeda ma'am through her website. I was in Bangalore at that point of time, so it was really easy for me to go visit her quickly. I think the first thing I did was take x-ray, and this time x-ray was itself different, and I was asked to stand up and sit down and take 2 x-rays, which then they explained to me what was the problem, and I think that was when I got the clarity. Syeda ma'am was able to give me a really clear diagnosis that this is the issue, this much angulation in my tailbone, and what are the next steps to work on this. So I think it really gave me clarity, because only when I knew what was wrong with me, I could really make sense of it and like think about next steps. The next step was really scary, because the procedure was manipulation, and I knew that it was something sounded really scary because it's very invasive. So I thought about it, but I really believed that that's the only way we could help, because tailbone sits in a place which is covered with muscles, so in order for you to move it, you need to be invasive. So I took up the treatment. I listened to everything ma'am had said. I think one thing I've learned is you need to be really thorough with the exercises, with what is asked from you, from taking rest. All of them really adds, and also checking your blood levels for vitamins, and making sure you follow everything for the next 2 weeks and more, and continue to do exercises. So when I went for my first manipulation session, I was scared, but I did not feel a thing when it was done. Like I did not feel very invasive, to be honest, and it was just over in less than a minute. Like we do exercises and then we do that, so you don't feel very jarred. And I think it also adds to ma'am. She's very patient, she's very calm, she does it to making sure you're very comfortable. So once I was able to do it, I was on a road to recovery. I made sure all the exercises were done right. I came back to ma'am for regular test, and it was a month that I did after the treatment. I was taking care of myself, and post that, actually I was able to travel back. Like for almost 3 months I couldn't travel. I didn't even visit my parents for festivals, but after that it was really like I was getting back to my feet, and I really felt that I was recovering. It is a hard journey to recover. Like it's a lot that happens in your mind that keeps telling you that something is off, but actually it's not. So at the end of the 1 month, we took another x-ray and we were able to see the improvement of tailbone, and I really was more confident at that point of time. So since then I have been pain-free. I have traveled to so many countries. I have been able to go to the gym, I have been swimming, I went on hiking. life seems normal, and I have been able to be in a very good shape after that. So I think my learning has been the early the diagnosis and early you act on this problem and stick to the routine, it really helps to recovery, and you will definitely be pain free. So I would highly encourage people who are going through this journey to be confident, fearless, and just go through this process, and I'm sure you will come out of it with pain free life. So yeah, thank you.
I was treated by Coccydynia clinic by Dr. Syeda Mubashira. It was a boon for me. I've been suffering from Coccydynia pain from past 25 years, since my son's delivery, and I found her at least 2 years ago, and it's been a great relief. I've been able to travel with her help, and with her sessions I've been able to sit for longer hours. Yes, of course, we also need to do our basic exercises, and her guidance really keeps us on path. It's been a great help. Her physiotherapy has helped me to a great extent, and this is uh, the only solution I found after years of hunting for a correct doctor. So she definitely worth trying, and I would highly recommend her services.